We get calls from people all over the country, all over the world actually now. And what we found so surprising is that most people don't realize that what the conventional medical community is referring to as Alzheimer's disease is really just a collection of symptoms and doesn't in any way identify the root cause, right? So can you elaborate on how the protocol is identifying the cause of the disease and not just addressing symptomatic issues?
Right. So this is a great point. And the analogy we always make is if you took your car into a mechanic and you said, things aren't going very well and I want to understand why, and the mechanic said to you, oh, Amy Lee, no problem. We see this. This is called car not working syndrome. And you say, well, oh, wait, aren't you going to do some tests to find out why it's not working? And they say, well, no, those tests aren't reimbursable. And that's been the problem in medicine, that the very tests that you need to understand what are the root causes of cognitive decline are tests that are not typically reimbursed. So you may want to know what your C4A is, or your TGF beta 1, or your fasting insulin, or your homocysteine, or your HSCRP, and write down the pike there, all these different things that are critical. The good news is if you actually look at the basic research, if you look at what does the signaling that leads to Alzheimer's actually do, how does it work, what you see is that there are dozens of things. The good news, it's not thousands, but there are dozens of things that lead to this same imbalance that we refer to as ultimately as Alzheimer's disease. And as you know, at the center of this amyloid precursor protein, the APP, is a molecular switch that you can cleave at a single site to produce two peptides, two fragments, that are both supportive of memory and supportive of sustaining the synapses. Or you can take that same molecule and cut it at 3 different sites and produce 4 pieces that all support pulling back. So you go one way or the other. And whether you're going to go on the positive side or the negative side really depends on whether things are good. If you've got very little inflammation and no toxic exposure and things are good nutritionally and hormonally and trophic factor wise, then you go toward the support side. But when you cannot support that neural network, you literally have a mismatch between the supply and the demand, then you have to pull back and you literally have a protective downsizing program. This fits very well with, as you know, with what Professors Robert Moyer and Rudy Tanzi from Harvard have shown, with the fact that amyloid beta is an antimicrobial peptide. And there are numerous other pieces of this, but ultimately it is about, can you support that network? So therefore, you're right, you really want to know, is there ongoing inflammation? Are there specific pathogens that you should be aware of? Is there glycotoxicity related to insulin resistance? Are there organic toxins? Are there metallotoxins? Are there inorganic toxins or biotoxins, as any of those? Are there vascular abnormalities? Are there nutritional deficiencies? These things all turn out to be important. And no big surprise when you don't have the ability to support this remarkable neural network. You've got almost a quadrillion synapses in your brain. When you cannot support that for any of those reasons, you undergo this downsizing program that ultimately we refer to as Alzheimer's. The good news is, as you know, you can see it for many years ahead of time, so you want to get in as early as possible. And as you said, ask, what are the critical factors causing this?